Hello and welcome. I'm Sophia Tomer Cruz, and today we're speaking with Dr. Ana Ong Lim, Dr. Eileen Espina, and Dr. Pauline Convacar to discuss the Philippines' response to the coronavirus pandemic so far and how medical groups work to strengthen government efforts after a 2-week return to slightly stricter rules under a modified enhanced community quarantine. For our audience, Dr. Ong Lim is a professor and division chief of the Infectious and Tropical Disease Department of Pediatrics at the University of the Philippines College of Medicine. Dr. Convacar is president of the Philippine College of Emergency Medicine. And Dr. Eileen Espina is a family medicine specialist, and she's also a local health systems development consultant and specialist in Northern Samar. So the three experts are part of the Healthcare Professionals Alliance Against COVID-19, or HPAC, a group of more than 100 medical societies who work closely with government to recalibrate the country's pandemic response. Thank you for joining us today. Let's jump right into it. So let's just backtrack a little bit, no? The group came together and made that public call to recalibrate our pandemic response. What went on behind that? Because that's something that I think the public felt was unprecedented, that hadn't really been felt before, at least also within the context of the pandemic. So how did the group come together and really unite and decide on making that call? I remember you mentioned that hospitals were being flooded, but what were other aspects that contributed to that?
Let me answer that, Sophia. Originally kasi, this was a call for a discussion among different medical professionals at the outset, just to try to figure out what we could do as a response to the increasing numbers of patients that we were each seeing in our institutions. And then, syempre, yung isang na-identify namin kaagad na problem was really how do we stem the tide? Because at that point, there were so many patients who were already in the emergency rooms, and a lot of the big hospitals were actually already issuing notices. Sabi nila, hindi na sila makatanggap ng pasyente. And I guess, what I felt as a participant in that, at that particular moment was really, we were all thinking the same thing, and we were just brought together by force of circumstance to share this particular impression that we needed to do something to stem the tide. And because I guess the call resonated with so many other people, it didn't take very long for people to jump on board and to buy into the idea na we have to do something as a group of medical professionals.
Mm-hmm. Is it accurate to say that it was something unprecedented also in the medical community?
I think so. I would say so because in most cases, we usually work within our own separate teams. Like I'm a pediatrician, I interact mostly with pediatricians. And within our communities, of course, we're able to move, but maybe to interact perhaps with the internists or the surgeons or the family medicine physicians, parang very rare for us to come together to back a particular cause. And we all know how big an impact COVID has had on our healthcare system.
Mm-hmm.
That is so true, no, Sophia? And what was also heartwarming was, nung inilabas yung call, because there was actually a letter that was drafted. And then it was circulated among the different medical specialty organizations, asking them if they would be willing to support it. And it just happened in a matter of hours. Ang daming nagsabi na, yes, we will support it. And hindi yun madaling gawin because the president cannot just say yes on his or her own. The board has to be consulted, and even the chapter presidents have to be consulted. So talagang snowballing yung effect, talagang ang bilis. In a matter of hours, we already had so many signatories. Hindi lang yung big societies, we have kasi the big 8. Under the Philippine Medical Association, meron kaming 8 specialty divisions.
Mm-hmm.
So under that 8 specialty divisions, meron pa yung mga subspecialty groups. So even the subspecialty groups, they signed up. And when we went live on August 1, the other healthcare professional organizations reached out. And they said, we want to be part of it. So from an original coalition of medical professionals, it became interprofessional. So the nurses joined, the midwives joined, the medtech, radtech. So ang dami. Nagkaisa kami. And right now we are at 172, if I'm not mistaken, 172 na member organizations.
Right now. So we can just imagine how many members those actually are. Siguro hundreds of thousands.
Million. It's a
Millions.
million.
Exactly.
Yes.
And Dr. Eileen, you mentioned where we are at right now. So bringing us to 2 weeks after you made that call, how would you assess the situation right now? The group mentioned 7 points, 7 issues in the government response that needed strengthening and needed improvement. After that 2 week return to a modified enhanced community quarantine, would you say those were all successfully addressed? Or what might still be lacking at this point?
I believe it's a work in progress. It's a work in progress. But what is heartening to note is the very positive response of the different government agencies, especially those who were concerned, the concerned government agencies na talagang makakasagot doon sa mga simptomas na we call them symptoms. And then we had a diagnosis kung sa tingin namin ano yung pwede nating magawa to address them. We're very receptive to the recommendations we have made, and we saw that they are trying to accommodate them, our recommendations, into the existing plans. So right now, probably ang magiging moving forward for HPAC is to see to it how we can continue to support them in whatever way we can in terms of our expertise, and also to enjoin the public to help us monitor the progress, no, of the response. If there's one thing that I would need to emphasize is that government cannot do this alone. Doctors, nurses, healthcare professionals cannot do this alone. We really need the people. We need the entire Filipino people to be with us. Yun ang talagang kailangan maintindihan ng bawat isa.
Mm-hmm.
Yes.
Right. So let's go into detail on some of the issues that you pointed out, that the group pointed out earlier 2 weeks ago, because one of them was hospital work deficiency, or a lack of health workers, let's say. And that's also something that was really tangible, not you mentioned earlier, that really propelled that call also to materialize and formalize. The government's response currently, main response to that so far was the one hospital command. But and that, of course, we know consists of setting up more beds, expanding capacity, expanding facilities dedicated to the coronavirus, and also setting up a referral system. Do you think that this is an adequate response to the problem that you see at hand on the ground?
I'll try to answer that, Sophia. Coming from the perspective of an incident command, and also coming from a perspective of an EM specialist, we saw from the very beginning that we observed some. We were the eyewitnesses to a symptom of congested emergency departments, a congested hospital. We saw the long queuing time, patients whom we cannot admit. That's why there's this call of some other hospitals to relatively close some of their doors kasi hindi na nila matatanggap. So, doon nag-umpisa yung, is this really a bed problem or this is a distribution problem? Kasi also, we have to see it on the perspective that magdagdag ka man ng bed, hindi ibig sabihin magiging functional na siya kaagad. Kasi you have to understand that a bed is just a bed. It's a physical bed. For it to be functional, we also have to address the healthcare worker that's supposed to attend to that bed. So yun yung isa doon. It may be a multifactorial answer because it's not a straightforward answer as well, because it's not just about addressing the physical number of beds or addressing the increasing the manpower or the human resource that go with that. It's also about development of systems. Kasi kahit na gaano kaganda yung kabilang hospital, kung hindi maayos yung distribution, hindi maayos yung classification and who goes to which place and to whom, ang sabi nga, ang parati ko nga sinasabi na the right patient to the right provider to the right facility. Kasi if you're not using that facility in an appropriate way, then there's really inequity and there's really distribution problem. So going back to the question on the One Hospital Command, it's not just about the structure, it's all about systems development. And then also addressing some other issues with healthcare worker distribution.
So picking up on what you said now, Dr. Convacar, how do we address what you mentioned about having maybe no system, or if not no system, then no clear system for a normal patient, let's say like me, if I get sick, what number do I call, where do I go? Paano yun na-address sa HPAC?
Okay. I think we need to also clear things up that there are already problems even before COVID. So actually, there's this running joke among us that we don't also want to COVIDize everything. There are existing problems even before COVID, and it's not really the absence of a system, but there is a system, but it's actually not just integrated into perspective, like say connecting everything. Our battle cry was protect the last line by strengthening the first line. Because there seems to be this disconnect. Yung sinasabi nga, baka silo mentality. Yung hospital hospital lang yung titingnan ko. And then the community will also fend for themselves. So there should be a paradigm shift as to seeing healthcare in a continuum. Hindi pwedeng, yun nga lang, from womb to tomb. You should see giving healthcare services in a continuum. Hindi dapat napuputol yung service, hindi dapat napuputol yung pag-alaga. Kaya nawawala kasi, the big issue is that nawawala o the patient gets lost in the system when they just drop to a facility, and then what next, because there's no more vacancy in that facility. Then the hospital hopping happens. Tapos, nawawala na sila sa sistema. So, we wanted to have something like, once the patient enters into any point of contact to any health facility or to any point of contact with a healthcare worker, you attend to that patient and make sure that that patient reaches the right facility and the right provider. So, yun yung parang hindi na tahi-tahi kasi although we know that there is already a service delivery network, that's a healthcare provider delivery network, that's really a program of the Department of Health. And we have to understand also that we have already a law on the universal healthcare wherein there is a gatekeeper. They will direct the patient to the right facility. But currently, there's no connect clearly because of decentralization of health services to the local government units. We really need to engage the community and our local government units to be part of this health referral network. So it's not just a standalone, this is a hospital problem and I'm full. So it's my problem to solve. It's not that. So we need to understand that the community really has a big role to contribute.
If I may add, Sophia, wearing my hat now as a gatekeeper. The family physicians are said to be the gatekeeper. The primary care strengthening. Providers. Yeah, the primary care providers talaga are the gatekeeper. Kasi yun ang kailangan natin ma-strengthen ngayon. So what is primary care? It's giving care at the level of the where at the community where the people are. It's bringing healthcare to the people, and it focuses more on prevention, health promotion, okay, health education. So yung question kasi natin dito is that kind of thinking ng ating mga kababayan that they can only access care, quality care in the hospital setting has been prevailing for the longest time. So with COVID, our statistics will show that 90% of cases or even more are actually mild. 92%. 8% lang daw ata ang kailangan ng hospital care. And yet, people are flocking to the hospitals. for one reason or another, people with COVID or COVID-like symptoms are going to the hospital and they're crowding the ER. So, even before COVID, problema na talaga
Yeah.
namin yan pag nagjo-duty kami sa ospital.
Mm-mm.
May ubo, may lagnat ng 3 araw na. Pupunta ng ospital ng 2:00 ng madaling araw, sasabay sa nabaril, sasabay sa naaksidente, sasabay sa nag-MI. Punong-puno yung ER. Tapos makikita mo, ang daming nandun na hindi dapat nandun. Kasi pwede naman sana siyang matingnan doon sa kanyang primary care facility. So that's what we're hoping na matuto ang tao na pumunta sa dapat or yung sinasabi ni Pauline na the right facility at the right time for the right case. Yung ano ba na kung sabi nga na kung hindi ka pang ER, wag ka nang pumunta ng ER kasi nakakadagdag ka sa nakakadagdag ka sa pila. At kaya tuloy nagiging masungit yung doktor kasi ginagawa nito dito. Nadagdag ka sa sakit ng ulo ko. Parang gano'n. And then, I mean, we're not saying that maybe for you it's an emergency because really, if you hear about COVID and you start feeling all those symptoms and you don't really understand what's happening, there is the fear. And we understand. It's the fear that's pushing the people to access care, to look for care. That's a very dictum na natutunan ko in my training that it's the anxiety actually that pushes the people to seek consult more than anything else. It's not the fever, but it's the fear that what if this is COVID? What if tomorrow I will die? Yung doktor nga na specialista, especially na yung unang labas ng balita sa COVID, ang daming doktor na namatay and we're still losing. We're still losing a lot of doctors. We just lost one recently. Masakit sa dibdib. Ni Ana, kasama ni Ana, and she's really an asset, no? And we're really losing a lot of people who we feel they don't deserve it. Nobody deserves to die from this, not just doctors but everybody. And yun yung dun when you hear stories like that and then you have these symptoms, anosmia, and then you start coughing and then oh my god, my neighbor died. Am I next? My children are still small. And then and a lot of things enter your mind and I had a patient. I mean, she's well educated, but she called me in the middle of the night at 10 o'clock. And then she was crying. And I said, why are you crying? You only have anosmia. And I was like, I only have anosmia. I'm about to die. No, you're not about to die. So So one of the things that HPAC wanted to do was to educate our patients, educate our kababayan about the illness, what they can do to prevent it, what they can do to keep themselves healthy, what they should do when they feel something, where they can go, where to call, what to do. And that's the system that Pauline was trying to describe in a nutshell. It shouldn't just be about going to the hospital, but in the community level as well, knowing who your births are, knowing who your barangay health station, where your barangay health station is, where your primary care provider clinic is, and going there and seeking the care that you need.
Right, no ma'am. But picking up on that, no. So in the context of COVID and really trying to instill that change in mindset, because that kind of thing doesn't happen overnight. So let's say tomorrow I start to feel a cough and everything. How does that translate to now? If I'm a patient and I feel all these things, of course, my natural inclination would still be to walk to the hospital. Because that's what I know. So, what was the proposed solution to that? Also, I think this is also something that will address, for example, the lack of health workers in certain facilities and everything, and the overwhelming number of patients studying. How will we address that right now in the short term? Kasi yun yung kailangan din eh.
Yes.
So we're offering telemedicine portals. Doc Ana, no? Like in PGH, there is a hotline that you can call. There is also COVID Kira. I think it's a chatbot that you can actually enter it's a DOH app that you can actually enter your symptoms and it tells you whether you have COVID, uh, maybe you're having COVID or not, and where you can go. Then I think the One Hospital Command also, you can also call the number, and it will also direct you. So, but we're trying to um, streamline a lot of things right now, and there is a call from DOH to the medical societies if we can also volunteer our time to man the telemedicine um, services, but that's still being ironed out as to how it would be.
The mechanics. So I was just about to say that what's very encouraging about this whole discussion was when this was being proposed, the government agencies that we were talking to, particularly DOH, were very receptive. And in fact, some of the proposals that came from the HPAC team were already in place in the DOH or in the other government agencies' plans. And it was something that really came together and validated their assessments and encouraged them to push through with whatever they already had in mind. I guess we can say na this interaction between the professional medical societies and those government agencies catalyzed maybe their resolve and their plans to really push through with some of the interventions that they already had in place.
Mm-hmm.
Sophia, may I add on to that?
Please, yes.
Will you allow me? Okay. But then don't get this wrong as well, because other people don't go to the hospitals anymore because they're too afraid to go there. Maybe they'll get COVID from there. So let me just put it in a way that when you're in doubt, you should visit, of course, a health facility. But we wanted to also develop a culture that in an ideal setting, if you're an emergency, you should not go to the hospital on your own and walk from your home to the hospital, because someone has to pick you up, adequately equipped, competent person to pick you up from the house if you're really an emergency. If you're not an emergency, then you may have a number to call. It's a single unified number to call just to ask questions. If you are an emergency, that's what we call teletriage. We sort patients as to classification of severity, and we will be able to guide you to which facility you will visit. So therefore, you don't need to, in an ideal setting, you don't need to drive, you don't need to walk, na hindi mo alam na kahawa ka in the process of you walking or going through that facility.
Right.
So yun yung gusto namin, if libreng mangarap, yun yung ideal setting. The system will look for ways for you to be brought to the right facility with a right provider even accompanying you from your house to that hospital or facility. Pangarap na pangarap ko yun. Sana maabot. But definitely not in the next 2 weeks, not even the next month. But we're hoping to reach that point. So yun lang yun. I'm sorry, but I have to emphasize, when in doubt and you feel like you're an emergency, you have a number to call and someone will pick you up in an ideal setting.
Right.
We also would want not to neglect our the collaterals of this war, those na hindi naman talaga COVID and hindi lang sila pumunta. And we're seeing a decreasing pattern of patients that seek consult at the ED. So lahat ngayon na nakikita ko, puro na lang COVID suspects and probables. Kasi takot ngang pumunta, heart attack na pala, stroke na pala. And that's really time critical. So I'm here saying that it's still safe to go to the hospital if it is indeed an emergency.
But picking up,
and you need a doctor to assess you.
Right. Picking up then on what you said, no, Dr. Convacar, because nga, these things are time sensitive. You mentioned, of course, we're in the process of, for example, setting those systems up, for instance, because it's not gonna appear overnight. But what are we actually taking the steps to really implement that system, put it in place, and what are those steps that are being taken para maging concrete talaga yung ideal system na yun?
I'm very, very happy that you're asking me these questions because I really want to answer all of them. Kasi even before COVID, I just gave a talk in the global emergency care in the University of Monash at kaninang alas 4. So they were asking us kasi na the Philippines is actually a country of disaster specialists, if I may say. Because we are visited frequently by typhoons, by earthquakes, and you know na actually nag-ano nga ako is this providence that hindi nagsabay si Taal and COVID? And I was even asked by my resident in Davao, Doktora, what will I do if, you remember there were series of earthquakes in Mindanao? And we have COVID. Anong gagawin namin? Paano namin sila paghahalu-haluin? Good question. Syempre, evacuate the patients first for earthquake and then think about the infection later. Because the sudden death in a very strong magnitude earthquake will kill on site. So, but anyway, going back, we are disaster specialists, and why are we not thinking about daily emergencies? Kasi magkaiba yung response sa disaster. Sa araw-araw may emergency, araw-araw dapat may tumatakbong emergency na maayos na ambulansya, maayos na referral ng paglipat-lipat ng hospital should be really addressed. Ang galing natin sa disaster, actually tayong tinitingala ng most with regards our disaster response. But our daily emergencies, we can't do something about. So yun yung topic kanina, no? So anyway, moving forward, we've already started sometime last year, mid of last year. We don't have an actual country assessment of what is the status of emergency care in the Philippines. So we were visited by WHO, and it is a national assessment for emergency care. Kasi nga sabi, even the burden of care of these emergencies, at the end of the day, all cases, chronic, and even injuries, they converge to being emergencies at the emergency departments. But we don't know the cost, we don't know the disability-adjusted life years, etc. as indicators for this burden of diseases and mortalities from there. We're more interested in some other, syempre iba-iba naman tayo ng specialty, iba-iba din yung focus. But anyway, that's the question. So, the bill for emergency medical services has been there for years. Yeah. So, it's supposed to standardize all emergency medical services systems. Have you noticed that when you call an ambulance in your barangay, it may look like an ambulance, but are you sure that there are competent people to be with you in that ambulance? So that's what I'm saying, that the care should be continuous, or it should be a spectrum of care that should be continuous from the house to the hospital or to your right facility. So I'm sorry if the answer may be lengthy, but I'm really grabbing this opportunity to also advocate that it's high time. As last na, Sophia, as I was saying, hindi blessing ang COVID na dumating, but it only highlighted the problems that were there even before this happened.
Right.
So let's just see this an opportunity, not really on the negative side of things, but as an opportunity that it's really high time to focus on that part of emergency care.
Right. But let's just drill into that just a little bit more before I move on to other topics, because we have a lot to cover, and the group also raised a lot of very good points. But just a little bit, drilling in a little bit to that point. So may ganyang bill pala sa Congress that hasn't been passed, and it's time to do that. But that's the long-term kind of thing, right? But to address the problem at hand right now that we see, kasi it's a whole process to get the bill passed, right? For example, when we're talking about that system that people will be able to be referred to the right place and everything, are we doing something? Are there concrete steps being taken to institute that? Or one hospital command lang ba yun? Or is there something that's being done to put up that sort of system in place? Para, so that people will also build the habit or build, as you mentioned, shift their mindset to something like that. In the short term now.
Definitely, there really are birthing pains. Kasi ang daming, tumawag naman ako, busy. Or like, tumawag ako, yung sagot ay ganito. Part of this referral network that's being developed is really public education. When is the best time to call? And if we even actually already have I'm not so sure about this, an executive order addressing prank calls to that hotline.
Mm.
So may mga ganun talaga. But anyway, going back, meron currently ginagawa, the One Hospital Command supposedly, initially it was supposed to only address those hospitals that were closing, and then also to address those patients who go hospital hopping because they were not accommodated.
Mhm.
Yun yung unang-una niyang intention.
Mhm.
But then we're not claiming that it may be an offshoot or a product of the one COVID referral network, but that's what we were really intending to really communicate to government. No, we should not see the hospital as a standalone or in a silo again, and not connect it to the community. That's why the initial words that we used to explain the evolution of the terminology was that you should expand the One Hospital Command. But then wait, it's not just about another hospital connecting to another hospital. We should see to it that it should include now and how this will connect now to testing, to tracing, because some questions really are just, I have this, where will I go to be, to have the test? So, but that for me is, if you really look at that, it's not a question of accessing hospital care. It's just asking, where do I go if I have these symptoms? So it's now, that's the reason why it is now the One Referral Network. So these are actually concrete steps which happened actually for the past 2 weeks lang din. And they just launched in August. I forgot the date. They just recently launched last Thursday, the One Hospital Command. But with the ongoing meetings, they are calling it expanded One Hospital Command or One COVID Referral Network.
Mm.
So it's a good thing, but it's also about habit and habit to call, and maybe public education as to when and how to use that system.
Mm-hmm. Right. So let's move a little bit to other areas, no? You mentioned that hospitals are essentially the last line of defense, right? And you want the communities to be able to have the mindset that, there are things that they can do to avoid the disease and everything. And the group touched on things like transportation and workplace safety. I guess coming into it, it wouldn't, first thought would be, pero you're health professionals. How come you're all of a sudden talking about transportation and public transport and then workplaces and businesses? So um, in line with that, no, at first glance, it doesn't seem explicitly linked to health. So why did the group target those things, and what was the logic behind bringing those things into the fold in coming up with a recalibrated pandemic response?
Sophia, can I try to answer that? Coming from the infectious disease perspective, no? I think if we understood the way this disease gets passed around, then it will be very evident that all of these aspects that don't seem to be related have to be addressed. Otherwise, we will not be successful in our goal of containing transmission. So, alam naman natin, no, na ang ginagalawan ng tao does not just involve his home or his community. We need to leave our homes to earn our livelihoods. And in the process, we need to be able to get to our workplaces safely. We need to be able to function in our workplaces safely so that when we get home, we don't infect our family members. So I think as medical professionals, we had this realization that, sige, kaya kong sagutin yung mga pumupunta sa ospital, kaya kong sagutin yung humaharap sa akin sa clinic, pero kung gano'n na lang ng gano'n, para naman akong kumukuha ng batong pinupukpok ko sa ulo ko kasi walang katapusan, di ba? So dapat ang ginagawa natin, let's try to address where this transmission is coming from so that in the end, those last lines of defense are able to function properly. Yun lang naman talaga yung pinagmulan ng buong intervention na to. And since we identified na, pagka sumakay ka ng hindi tama ang sasakyan mo at hindi ka maingat, pwede kang mahawa. Eh, di pati yun, papakialaman natin, di ba?
If I may add, no, health kasi doesn't exist in a vacuum. We have what we call the social determinants of health. Health is a product the interplay of our environment, of the food that we eat, of the air that we breathe, and everything else. And relating it to what Doc Anna has said na we need to understand how the virus is being transmitted from one person to another. And transmission can happen as people move from one area to another. And if we cannot also separate livelihood from buhay at hanap buhay, magkasama yan eh. Hindi tayo pwedeng mag-lockdown na lang forever. Hindi tayo pwedeng magtago sa loob ng bahay na probably in the first weeks, the lockdown was actually, kaya tayo nag-lockdown kasi we wanted to buy time. That was the very reason why we had a lockdown in the first place. Because we wanted to slow down yung pagdami ng kaso. Kasi sa totoo lang, kung hindi talaga tayo nag-lockdown noon, nung March, I don't know kung gaano kabilis, Doc Ana, no, yung pagdami ng kaso if there was not a strict lockdown that was implemented in March. The lockdown that was implemented was a way for government to put in the needed preparation to prepare the hospitals, to assess the capacity of the healthcare system, and to address them, like build testing centers, mag ano ng tao, mag-procure ng PPP, train people, etc. So that pag binuksan mo na ulit yung gates, no, we let people start to go out slowly. At whether we like it or not, the virus is here. At kahit anong ingat natin, meron talagang mahahawa. It happens, even to the best of us. It's not because we were pabaya, it's not because we were pasaway, but maybe in a moment na kahit kami, doktor, no, minsan nakakalimutan mo, madumi na pala yung kamay mo because you were touching something, unconsciously you rub your nose. And it's a unconscious act. And in those unguarded moments, nahahawa ka. So yun. So we tried to understand saan ba pwedeng maghawaan. 'Di ba? MRT. My God, para kang nakikipag pagpunuan ng MRT. I've tried at rush hour and it's like a pack, So we said, hindi na pwede yun na yung punuan ng MRT na nagpapalitan na kayo ng mukha dahil masyado na kayo magkadikit. Hindi na talaga pwede yun. So we tried to identify areas where transmission can happen. And among those areas, transportation was one of those identified. Workplaces was one of those identified. So, sabi namin, if we want businesses to open, we have to make sure that the workers are safe. At hindi sila maghahawa-hawa in the workplace and then bring the infection home.
Right.
And then infect their household. So kaya siya naging ganun. We wanted to make sure that when we reopen, people are safe and businesses will open and remain open.
Right. So interesting din, no? I mean, in addressing those areas, it's also a way to safeguard, a more sustainable way to reopen the economy. But picking up on that, no, just going again to another area, jumping to another area, one thing that was pointed out was also the issue of contact tracing, which until now, admittedly, is an area where we're lacking. By many standards, if you want to be technical about it, kulang yung mga contact tracers and everything. So in your discussions, no, with national government and some local government officials, Dr. Eileen, you're somebody who is a consultant, no, for local healthcare and everything. What were the gaps that you saw or that continue to persist over 5 months into this pandemic?
I was just in a House of Representatives committee hearing earlier today, and I had the privilege of listening to the presentation of Mayor Benji Magalong, the contact tracing char, and part of the work that he did was to conduct an assessment of the contact tracing appreciation of the different local government units. And as a result of this study, he found out that a lot of LGUs are actually not prepared. And they don't have an appreciation, a deeper appreciation of the important role of contact tracing in cutting the chain of transmission. So, yun yung problema. So, we're trying to catch up the NTF through Mayor Magalong as the contact tracing char is trying to catch up. They're conducting capability building, umiikot sila, and in the Bayanihan Hilalsuan Act version 2, yung PAHO 2, I think they will be given budget to hire contact tracers and to do training. But in the meantime, habang ginagawa yan, I would like to turn it over to Dr. Ana kasi siya yung infectious disease specialist. Meron po tayong pwedeng magawa. So, take it away, Dr. Ana. Paano ba?
So, alam naman natin, it will take some time to get this off the ground. So, I guess the mindset that we want to inculcate in each individual is first to consider themselves and the people that they meet to be possibly infected already. And so what you want is to convert that encounter into what is called a low-risk interaction so that the possibility of you getting the disease or transmitting the disease becomes as low as possible. So what does that mean? This is actually just practicing the minimum health standards na paulit-ulit-ulit na sinishare, which is keeping your distance, making sure that you're wearing a mask and if possible a face shield, and keeping your hands clean so that if ever you inadvertently touch your face, you're not putting the virus into a portal of entry. Now, if that was the way you were always operating day in and day out, and you suddenly find out that, ay, si Doc Eileen pala was sick when the last time we met. So, dapat ang iisipin ko, sandali lang, nung nagkita ba kami, naka-mask ba ako, naka-face shield ba ako? Kung masasagot kong oo, ang next na itatanong ko, si Doc Eileen, oo, naka-mask and face shield pala siya. Therefore, low risk kami, okay na ako. Kaya kong matulog ng mahimbing. So, ganun lang. It's a very simple intervention. Hindi na kailangan ng contact tracer. Diba? Kasi, dapat mababa yung chance na magkahawaan kami.
If I may add to that, Sophia, di natuwa lang ako, Doc Ana, na-inspire ako kasi parang you're telling me now, no, I'm listening to you as I'm your target audience, not me as a colleague here. Parang nasasabi mo kasi sa akin na kasi yung responsibility kasi hindi naman, nasa sayo. Nasa sayo yung responsibility to make sure that even if you have contact, even if you're exposed, making sure that that interaction may be classified as low risk is up to me. And then it's also up to me to monitor after exposure if I may develop the symptoms or not. So kumbaga proactive na natutuwa ako because ako yun ang estudyante man, I really get the message. Even if yung, yan nga, even as doctors, diba, we tend to, when we talk to each other, it's about the core of the message. So thank you for that. Ako tuloy yung na-inspire. Sophia, sorry.
And one more thing, Sophia, no? Kasi an example na ako ni Doc Ana na ako yung may sakit. I also have a responsibility, kung, it's okay, kung sakaling magkasakit ako, if I feel na tawagan ko yung mga nakasalamuha ko, nakilala ko. So that's why in our press con, I mentioned about keeping a diary of where you've been, who have you been with every day. So, mag-journaling tayo everyday, no? Sulat natin, saan ba ako pumunta mula kayo ng umaga? Punta ako ng tindahan, ilang minuto ba ako doon? Nakipag-chika ba ako sa guard? May mask ba siya? So, sulat ko siya lahat. So, tapos, when I start having symptoms, balikan ko lang. Kasi, ang sabi sa atin ng literature, infectious ako 2 to 3 days before the onset of symptoms. 2 to 3 days lang. So, balikan ko lang. Where have I been Monday, Tuesday, Wednesday? 3 araw. Nasaan ako? Kasi ngayong gabi ako nag-start umubo, nag-start na makaramdam ng simptomas. Tapos kung kilala ko mga to, and I have their number, and I have a way of contacting them, I tell them, well, you know what ha, don't panic. Pero feeling ko may nararamdaman akong kakaiba. Magkasama tayo, pero nakamask naman ako. Sinasabihan lang kita, just in case. I mean, let's try to be proactive. Wala hong dapat ikahiya kung tayo po ay mahawa ng COVID. So, let's try to do away with that thinking na nakakahiya na nahawa ako ng COVID. Kasi if we have been responsible, we have been wearing a mask, we have been washing our hands and keeping our distance, the chances na we will be infecting others would really become lower. And us ourselves getting infected is also lowered.
But just an additional question to that, no? So it's good to know that there's something that people themselves can do in the meantime na ramp up pa natin yung contact tracing. But our health workers and health groups, HPAC, are they also working with, for example, contact tracings are in Bagimir, Benji Magalong, and other local governments to help give that expertise and strengthen their response? Is that something that the group is actively doing too?
Ako, on a personal note, no, I'm doing a lot of work with workplaces. So we're doing training for contact training in workplaces. But for LGUs, we have not really ventured into actual capacity building activities with them. But that can be explored.
Let's just take a step back a little bit, no? Because the 2 weeks has passed. We're actually another August 26th. Today we're about a week into general community quarantine again. So less strict quarantine rules. How was your plan and all your proposals received by bodies like the National Task Force, the IATF, and the DOH too? Is the group still actively working with them? How are these solutions received? Kasi at the end of the day, sila din yung magde-decide and like kakascade sa mga local governments and agencies.
So, Sophia, if I can try to answer that question. I don't think as a group we're making any claims naman to be the only experts in the field. But what I feel has happened as this group has taken off the ground is really to show the different government agencies that we are available, that they can feel free to touch base with us. We're very willing to share our expertise and our inputs, and we can access the rest of the professional medical community to be able to provide the expertise that they need, no? Kasi syempre, admittedly, this is a health crisis, but the movers are people who are not in health. So there will be bound to be some kind of disconnect. So parang ang gusto lang namin ipakita is willing kaming tumulong. Tapos you can contact us and we can bridge. No, that's been, I think, one of our primary roles, no, bridging the gap between the different agencies, the different actors in this particular arena.
Yeah, no, with health, I mean, of course, with your expertise in health and understanding the disease foremost in mind. But on that note, then, I think one thing that's interesting about the responses and the solutions that you've given, as well as the areas that you pointed out before, is that it captures what you mentioned, a broad response to the pandemic right now, because it covers so many areas. But while it's geared towards an infectious disease, COVID-19, do you see this perhaps as like a blueprint or something like a template of response that can be used for future emergencies and pandemics? Kasi, di ba sabi din ni Dr. Convacar, we're a country that is that has experienced so many emergencies and disasters. Is this something that can be translated in a different setting? Kung may emergency man lang ulit or may pandemic ulit?
I will answer first. Actually, when I was preparing as early as March, we were already using the disaster risk reduction formula for this, because kaming mga DRR practitioners, we have been working we who have been working in disasters, we considered this pandemic as a slow onset disaster. Ang pagkakaiba kasi ng emergency at disaster, sabi nga ni Pauline, araw-araw may emergency. Pero hanggang kaya pa ng system na matugunan yung mga uh, um, morbidities, no? Yung mga nagkakasakit, na nagkakaroon ng trauma, ng injuries, we don't call it a disaster yet. But once the system is overwhelmed and it leads to loss of lives, it leads to loss of property and a lot of economic loss, then it becomes a disaster. So the things that we're doing now, like calling for strengthening of the ICT, information communications technology backbone, strengthening the emergency medical services, EMS, ensuring the continuum of care from the community to the hospital, coordinating and linking communities to each other, and strengthening primary care. These are all things that are part of the Sendai framework. Yung Sendai framework, no, which happened after Typhoon Yolanda, uh, really called for disaster risk reduction and mitigation. Unlike before in the Hyogo framework, na it was focused more on preparedness and response. Yung Sendai ngayon is focused more really on risk reduction and mitigation. So if we are able to strengthen our healthcare system and make it more resilient, then probably kahit anong bagyo ang dumating, kahit anong earthquake, kahit ano pang pandemic ang dumating, God forbid, not another COVID, we will be better equipped. We will be better equipped. Kasi in terms of resilience as a people, andyan na siya eh. Ang Pinoy talaga basically resilient. I'm a survivor of Typhoon Yolanda. And in all the pictures of Typhoon Yolanda, pag makakita ng camera, magsasmile pa rin ng Pinoy. Despite everything, in spite of everything, we have the capacity to always find the good, to always find that ray of hope, that concept that there is always a light at the end of the tunnel. So yun yung ano ko eh, yun yung that's the one thing that inspires me to say that yes, we can rise over this and we can make ourselves stronger and we can build a more resilient healthcare system that can withstand any type of disaster in the future.
Dr. Anna, Dr. Pauline, do you want to add anything to that?
Okay.
Do you see this as something that can be some responses that can be also, for example, the referral network that can be tapped again, that can be used again later on if needed during an emergency or a disaster?
When I was listening to Dr. Aileen kasi, yung disaster framework, that's what she was using. I'm looking also at it, at the perspective of being an emergency, the discipline of emergency medicine. But having said that, hindi pwedeng nasa bubble ko lang ako eh. I need to also see. Long answer is that there's always a health issue in all kinds of issues in the entire society. So yung parating sinasabi, whole of society approach, whole of community approach, intersectoral, interdisciplinary approach. I think this is the best example of things unfolding. Kasi yun nga, if I continue to live in my bubble, I'll just stay in my emergency department and then wait for a patient because that's what I was trained for and that's my specialty. But being a restless person and you just receiving papasok ng surge of patients, you get to ask, baka may problema sa system kasi bakit sila dito dumadagsa? Tapos, so, mag-iisip ka. And then, so, looking at it as a probable blueprint, which may be effective also in some other possible scenarios in the future, God forbid. But I think this is one best example of a working whole of society, whole of community approach of people getting together with different specialties, bringing their own expertise into the playing field, and just working. And actually, it's just like another person on somebody else's shoulder and cheering someone on, cheering someone to continue with their own fight. Doon ako na-inspire kasi sinabi ko nga before I'm done with the 2 weeks. We did not rest. I'm ready to go back to work, the usual work that you really do, but
seeing patients.
See patients, because that's we have our own specialties. We are clinicians, but they're also public health practitioners and all. I think it's one good example of a thing that may be effective in the future. But let me just get this across that this may be debatable, and Dr. Eileen may agree or not agree with me, but disasters, even if they're of different nature, is quite predictable in the phases. So maybe Dr. Eileen may pick up on that, because when you plan for something, even before the disaster happens, you have to have a plan. And sadly, hindi kasi natin naiisip parati nating nasasulat lang sa plans natin our natural disasters. So what to do in a typhoon, how to evacuate a building when there's fire, when there's flood, or when there's earthquake. But have we ever incorporated our response to medical emergencies or medical disasters into our plan? And even like say, yes, everything is there except, for example, like bomb scare. Did you even consider that, putting that in the plan? But regardless of kinds of disaster, the approach and the system of response have these similarities. So parang tayo kasi magiging, when you do your drills, when you plan your drill, and when you drill your plan, nagiging muscle memory yung anong gagawin next. So that's what we're hoping to do, rising from this experience of COVID, and hoping na yung learning na yon we may be able to also pass on to the next generation. Hopefully wala nang mangyaring ganito, kasi this is really something. Kaiba siya.
Pero at least
Dr. Eileen, baka makadagdag ka doon, kasi
hindi na starting from scratch, if ever.
Yes.
The DRR cycle kasi is the same. So it's a 4-part cycle. So you start with disaster risk reduction mitigation, then you have preparedness to respond, then you have the response phase, then you have the recovery and rehabilitation. So you just have to relate it to everything. So ang sinasabi ni Pauline is right now we are in the middle of the response phase for NCR, no? But Batanes right now is 0. So Batanes is in preparedness. So pag nagkaroon ng isang kaso si Batanes, they go into response. So hopefully while Batanes is in the preparedness, inayos na niya yung kanyang disaster risk reduction. So anong ginawa ni Batanes? They closed their borders. That's how they reduce the risk. That was their strategy. But this is just an example. So, in NCR, for example, in Pasig, titingnan mo rin per barangay. Baka may barangay pa na isa lang yung kaso, may barangay na 100 yung kaso. So, iba-iba sila. Iba-iba yung ginagawa nila at this point in time. So, if you have 100 cases, then it's an outbreak. You are at the very height of the response. But it's the same cycle. Then once you're able to control it, you go back to recovery and rehabilitation and go back again to risk reduction and then wait. Pag may dumating na naman, span ka na naman. So ikot lang yan. Umiikot lang yan. It's the same for typhoons. It's the same for an earthquake. We have been preparing, God forbid, for the big one since I was a medical student.
Right. No.
Tagal na rin. Yeah.
Right. So, I mean, picking up on what you said then, Dr. Espina, because we're still in the response phase. Cases are still rising. Today, August 26, we already surpassed the 200,000 mark. And at least in Metro Manila, the epicenter of the pandemic here in the Philippines, tumataas pa rin yung mga kaso. So, do you think, or would you, doctors, say that are we still losing the battle against COVID-19? Are we still losing? Is your assessment from 2, 3 weeks earlier in the month, does that still hold? And do you see the country turning the corner anytime soon, or is it too early to tell?
I would say I'm more hopeful this week than I was before the MECQ was declared, no? And I'm taking off from the fact that I saw how the different agencies were very receptive to the suggestions that were brought forward by actually, sino ba naman kami? Sa totoo lang, sino ba kami? 'Di ba? Wala naman kaming posisyon. Nagsama-sama lang kami and we felt that we had something to contribute. And alam mo, ang dali lang naman din sabihin ng mga government agencies na, sino ba kayo? But they were willing to listen. So I'm really actually taking off from that perspective that people are willing to link hands and use their collective strength to be able to um, respond to this crisis. And if we're able to just keep that kind of momentum going, just open the channels of communication, just make sure that we support each other in the programs that we have and be willing to listen and change yung mga hindi natin dapat ginagawa, I think meron tayong pupuntahan. Hindi naman siguro imposible yung situation natin.
Right. And I guess, no, picking up on that too, over 5 months into the pandemic, how are you all feeling now? Na, I mean, the WHO recently said the pandemic is still it's gonna stick around for the foreseeable future, for the near future. How are you feeling now? Do you have hope that we'll survive, that we'll come out of this on the other side?
Oo naman. Of course. Yes.
Mm-hmm. But how are you feeling now? Also, is it the same with Dr. Adam or Dr. Espina about the response also that the response, at least for, let's say, the rest of the year, the current government response, especially after the health groups really also lent their expertise then?
I have always been an optimistic person. I have always chosen to see my glass as always being half full. And probably because of the experiences I've had in my life, na I always choose, sabi nga ni Catriona Gray, I choose to see the silver lining. Oo. Pang-Miss Universe yan. No. Kidding aside, no, it's okay not to feel okay. We will be hypocrites if we say that we're happy, that, it's not a joke being cooped up in our small world, in our we're not able to do the things that we were able to do before. You long for that, and you grieve actually for the life we used to have before COVID, and you ask yourself, babalik pa ba yun? Kailan yun babalik? Especially when you don't seem to see the end right now. Parang, kailan ba ito matatapos? It's like when we were children and you keep on asking, you're on a road trip, are we there yet? Parang, ang tagal na, no? And so, to people out there listening, it's okay. It's okay to feel bad, to feel sad, to feel angry. It's part of the process. And kapit lang, besh. Yun lang eh. Kapit lang. And we hold on, and we try to keep ourselves positive, keep ourselves sane. And if there are moments na gusto mong umiyak, it's okay. It's okay to cry. Tao lang po, napapagod din. But after you cry, you brush yourself off, get up. Sabi nga sa kanta, put on some makeup. Be beautiful and face the world again. Yun lang. That's how I take it. I take it one day at a time. One day at a time.
Right. Thank you for that, no, Dr. Spina. Speaking of one day at a time, maybe on a last note, on a parting note, if there was one thing that you would really want to see in the immediate term in terms of perhaps response or not from the government or let's say the community people, what might that one thing be? Or one thing to prioritize, one thing you really you want to see happen, one thing you expect. Maybe you can start with Dr. Pauline Convacar.
Kasi tinitingnan ko kung how, nag-ano ako, na-fixate ako doon sa how are you feeling. So I parang, while Dr. Espina was talking, I was tempted to say, but there is also such a thing as a positive toxicity. So tama naman din, it's okay not to be okay. Hindi pwedeng positive lang lahat. Kasi there were moments, especially with my experience. So there were really moments when may mga tanong yung iba na why me, why? Wala akong ganun. It was more about, I want to go back to work because that's where I can contribute for to this fight and I'm not even thinking about myself at the time, but I'm more thinking about those people who worry about me. So parang ganon. So sorry if I was fixated in that question. But if there's one thing that I want right now, to be able to sleep peacefully. Medyo selfish na wish. And then for others to have also the same thing, to be able to be at peace at night, and to be able to wake up in the morning and whatever it is that you were born in this world to do, be able to continue doing that. Mm-hmm. Parang dun muna ako sa ngayon kasi I cannot see beyond this pa eh. But I'm hopeful, but not within these few months from here on. Ano lang din, sige gagaya na nga lang ako kay Miss Catriona Gray. One day at a time, silver lining. Sige na lang, sige. Pero medyo confusing yung feeling ko ngayon. Maybe because I'm coming from a different perspective, having had that experience.
Mm-hmm. So yeah, Dr. Espino, one thing that you want to see happen in a response in the coming months?
Acceptance.
Mm-hmm.
Acceptance ng mga kababayan natin na COVID is here to stay. Mm-hmm. And we should all learn a new way of life na we might really need to wear masks for the next months, even a year. And mahirap siyang tanggapin, but yun ang prayer ko for everybody to accept that life as we know it before COVID will never be the same. And we just try to make the most kung ano yung what's in front of us and be innovative in designing. So parang consider siyang reboot. Kung paano parang i-reboot mo, no? How would my life be from here on? How can I continue enjoying my life, continue getting the best out of life with COVID?
Mm-hmm. So, what I wanted to see, sana, as part of our response is really more of cooperation and coordination across all sectors and across all levels. Because I think what I saw from interacting with the different agencies was really there was no monopoly of good ideas by just one person or one group. Maraming may magagandang suggestions and in fact, marami dun sa mga plano na sinuggest ng grupo were already in there, maybe not in the same way, but following the same process or the same wavelength, no? And what really was needed was just bridging these ideas together, getting them together so that it moved as one cohesive response. I think that's maybe one of the frustrations of a lot of people. They don't seem to see na, saan pa tayo pupunta? Mm-hmm. So maybe, yun yung kailangan natin. cooperation across the different agencies, cooperation of the public with government, no? And coordination across all sectors so that we move all of this together. May nagsasabi na, di ba, nasa iisang bangka tayo. So, totoo yun. And hindi tayo makakarating to the other side of whatever this will bring us kung hindi tayo magtutulong-tulong.
Mm-hmm. Right. No. On that note, we're also with you in hoping for the same things and hoping for a coordinated response and for people to sleep soundly at night, and also for people to, accept that there are certain things that we need to change if we're going to live with the virus. No. And on that note, thank you so much for joining us today. Thank you for your time and thank you for your service also. We hope to have you back here with us again soon.